Hey everyone, welcome to my channel. My name is Vanza, and this is a vlog of my unmasking as I got a late autism and ADHD diagnosis. And today, I'm hopefully going to keep this a short video, but I got a comment, and instead of typing out an answer, I've had this comment come up many times on my channel, so I just wanted to make a video about it. I'm going to use this comment and block out the name for privacy's sake. But again, I'm using it because this is a question that I've been asked so many times, and I think it deserves its own video. Okay, so a couple things before I go into the comment. One, I'm not a medical expert. I speak from lived experience. I was diagnosed a little over 2 years ago, and I have been a part of the autism community in that amount of time, hearing from lots and lots of different voices and lots of different levels of people on the spectrum. I've also been a disability advocate loosely my entire life, so that kind of brings its own perspective into things. Second thing is that the autism community is not a monolith. We all have our own very unique perspectives and co-occurring either disabilities or circumstances that make each presentation of autism extremely unique. So advice that I give on here may not be applicable to you. And third, this comment isn't verbatim, but it is a recurring theme that I get asked quite often. So thank you so much for making this video. I haven't been diagnosed with autism. Not sure if I need the diagnosis, and then they said that's a dilemma that they're working through, or if I'd be taking this opportunity away from somebody in need. Although the more I look into it, the more my life makes sense. I'm 50. Oh, and then she gave me a compliment. She says that she has fabulous gray wavy hair, and she thinks that I look stunning when my hair turns. This was on a video before I did my big chop, where I had like a really long curly hair, but my curls are still shining. But so yes, I appreciate the compliment. I love compliments on my hair. It's my favorite feature. Okay, I paused because I need a fidget. Okay, so the thing that I want to talk about in this video is medically diagnosed versus self-diagnosis, and whether or not you may or may not want to pursue a diagnosis, and some things just to think about and consider. So I am medically diagnosed. I did that for a couple of reasons. One, I got diagnosed about a month after my teens got diagnosed, and the place that we went to sees people, I think it's 13 and above. It might be 14 and above. I don't remember what their cutoff was, but they specialize in late diagnosed autism. They don't do any kids. And when I was going through the process of finding out if they were autistic and or ADHD, I was learning so much, and I realized that I had so many of the traits too that I didn't know about, because I also was somebody who had a vague understanding of autism, probably actually more than most people, just because, again, I have a background in disability advocacy, and I had spent time around people who are autistic, but those people didn't present like me, so I didn't see myself in their diagnosis, which is really, really common, especially for women who mask really highly. And at the time, I had no idea what masking was. I had never heard that term. So I already had a place. Like, one of the barriers to getting a diagnosis is finding a place that will provide a late autism diagnosis. There are still so many psychologists out there that are basing autism on old models, and women will come in, and if they're masking and do really good eye contact, the psychologist will say, you're not autistic because you can do eye contact. And that is ridiculous, because that's sometimes part of masking. So it is really, really frustrating to go in and find a place, spend money, and then be told you're not autistic and being left confused, and then getting told maybe you have not bipolar. Yes, that one. Either borderline personality disorder or bipolar is a common misdiagnosis for autism. And then these people that I've talked to, a year or two later will come across a therapist or somebody else who's like, no, I really do think you're autistic. You should go to, and they find a different resource, and then they do get the autism diagnosis. And it's like, yes, this sounds and fits so much better. I'm autistic. I'm not, depressed or anxious. Well, you might be both of those things too, but, as a diagnosis instead of autism. So, the place that I found specializes in late diagnosed autistic and especially understood that how high masking women present. So that was a really big hurdle that I just kind of accidentally came across. Like, I got lucky when I found this place. And then when I looked into them, I realized that, oh yeah, they are actually really a good diagnostic facility. Also, the psychologist that diagnosed me is autistic and ADHD himself, which I think, is good because he can see he understands from an internal, not just an observational level. And I was lucky that my insurance did cover a evaluation, because a lot of insurances don't, or they don't cover it very well. It was still expensive. But I'm fortunate enough that it was within my means to do so. So that's another reason why I decided to get a diagnosis. The other reason why I decided to pursue, and this one was really just icing on the cake. I had started my channel actually probably a week or two before I decided to pursue an autism diagnosis. My first couple of videos are just talking about aphantasia and my memory disorder, SDAM. Now, I am not medically diagnosed on those two because they are not in the DSM yet or any diagnostic manual. They are still being researched. So I talk about my experience living with a memory disorder and having aphantasia, but I'm not medically diagnosed. But there wasn't much information on YouTube at that time, so I wanted to put up a couple videos. Well, then when I started to wonder if I was actually autistic, I'm like, if I want to talk about this, then I probably should get a medical diagnosis, because for me, that was important. I am not, and listen to my words carefully, I do believe that self-diagnosed autism is valid. And if you are a content creator who is self-diagnosed, I think that is a valid lived experience and should be shared. I do think that there should be transparency, whether or not people, if you are sharing on a big platform, whether you are self-diagnosed or medically diagnosed. I think that's important for people to listen to and have that information so that they can decide for themselves. Because even though I'm medically diagnosed autistic, I'm not an expert. So people watching me, you are getting my lived experience. So same thing, if you're watching somebody who is self-diagnosed, you are getting their lived experience also. Both are very valid, but I do think I love context. I'm autistic. I love context. I want to know the entire context around it. So that's why it's important to me. It's mostly about the context. Just like more information, the better, right? Okay. So those are the reasons why I got a medical diagnosis. My family's out there talking. It's distracting. Okay, hold on. It was important for me, for my kids to get a diagnosis, because at this point I had homeschooled them up to 8th grade. I started to go into autistic burnout, and for that and many, many, many other reasons, we decided we were going to put them into a public school. And but their anxiety like shot through the roof. And that was probably because, again, they were undiagnosed autistic, routine change, all of that basically spiraled them into an autistic burnout. But we didn't know. We had no idea they were autistic. Because, okay, that's all. I'm not going to go down that tangent. But it relies to genetics. Like the things that they did, I did as a kid, so I thought they were normal. So, I didn't have, that much to suspect. Minus the fact that I did ask a therapist when they were 7 if they might be autistic, and she told me no. So that would have changed the trajectory of all of our lives, but whatever. So they were 14, and because we were going to go into the public school system, at that point I was starting to suspect they were autistic and ADHD, so we wanted to get a diagnosis so that they could get an IEP. So if you are somebody who is wondering if you should get your child an autism and ADHD diagnosis, and they're in the public school system, I 100% think you should, because they need the IEPs and the 504s. If you're in America, I don't know what other countries' accommodation things look like, but in America, to be able to get the IEP and the 504. Never mind that Trump is wanting to get rid of the Department of Education, which will get rid of IEPs. Hopefully that doesn't pass Congress and we won't be having that conversation. But the IEPs have been very, very helpful for my kids. I can make a whole other video on that if anybody has any interest. Okay, so, but if you are an adult and you're trying to decide if you want to get an autism evaluation. So here's a couple things I would consider. One is it accessible to you? Unfortunately, one of the reasons why I believe self-realized autism is valid is because it just plain and simple isn't accessible for many people. The unemployment or the underemployment rate, meaning that you are working in a job that you are overqualified for, it's 85% for autistic people, meaning many of us don't have insurance, or we're working part-time jobs, or our insurance is like not a very good insurance. And so you may not be able to afford a out-of-pocket cash evaluation for autism. And again, some insurances will cover it, but just barely. So it may not be accessible. Also, you might live in a rural area and the closest evaluator might be an hour and a half, 2 hours away. And I met with my evaluator 3 or 4 times. And that's not accessible for everybody. So is it accessible? 2, do you have plans of ever leaving the country? Because right now, New Zealand, I think the UK, you have to check up. I'm not going to research it because it's changing. Because Canada was one, but they've actually recently changed where they will let autistic people come in. But there are many countries that if you are autistic, that disqualifies you from trying to move to that country, if it's on your, medical history. Okay, another reason why some adults debate whether or not to get an autism diagnosis is because if you are in a marriage where you're not feeling quite safe and you get labeled autistic, there are very, very small, but it happens, cases where the judge will not grant custody of your children because of an autism diagnosis. I'm hoping that doesn't happen as much anymore, because I think like most autistic people can prove competency. We are very capable of raising children. Not all autistic people are capable of raising children, of course, because again, it's a spectrum, but many, many, many of us are. So I would talk to a lawyer before using that as a reason whether or not to get a diagnosis or not. I mean, I can't really say that for sure, but it is a reason that I've heard from other people. I don't think there's that much validity in it, but again, the way that our government, if you're an American, is going, and I wouldn't, if someone had that as a concern, I wouldn't be surprised. So in the comment, I want to address, would I be taking this opportunity away from somebody in need? No, you wouldn't. For one, you have just as much need as anybody else. A lot of times, autistic people, we tend to put our needs behind other people. But that's part of the masking and part of all of that. We oftentimes like, oh no, you need it more. But your need is just as important as anybody else. That comes from a scarcity mindset, and we all need to collectively work towards abundancy mindset. The resources exist, they're not being utilized correctly. And if you don't ask for the resources that you deserve as a human, then of course they're never going to give them to you. So if you feel like you would benefit from an autism evaluation, then you are the person who is in need of it. Plain and simple. You are not taking resources away from anybody else. Also, as an adult autistic person, there are very, 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 like, unless you get diagnosed level 3, which isn't most likely going to happen. Hold on, my dog. A level 3 diagnosis is just not likely to happen as a late diagnosed autistic person, because you probably would have been diagnosed as a child. And there are resources, there are caretakers, there are different things for people with much, much higher support needs. But if you've needed that level of high support needs, then you've probably already have been diagnosed. And so with people with low support needs, unfortunately, even though we are low support needs, not no support needs, there aren't any supports out there for us. Now, I can't really speak of employment because I have never really been employed by a company. So autism is protected under ADA. So an employer would be required to provide some accommodations, reasonable accommodations for you. There's that whole catch-22 about if you tell your employer, will they try to find a way to fire you, even though it's illegal? Again, I can't really speak to that as a lived experience, but I do know that it is a concern for some people, and in their jobs, they do not want to be labeled autistic because of their job. It's one reason why I have my channel and I speak out, because I'm in a privileged place where if somebody finds out that I'm autistic, there's nothing they can do. They can't fire me. I don't work anywhere. So most of the accommodations that come are self-accommodations, like the fact that I use noise dampening earplugs. I know now to rest and recover. I use fidgets around whenever I need them. Again, these are things that aren't provided by a government resource or anything like that. Now, that being said, this is not a short video. I can't make a short video. That being said, one reason why, as an adult, to get a medical diagnosis is because, and this, again, I'm not an expert. This is my pattern recognition and lived experience. Autism comes with a lot of co-occurring conditions. Very few people are autistic and that's it. Autism in POTS is very common, which is an autoimmune disorder. Autism and ADHD. I mean, there's a lot. And people, like, autism is neurological, but it affects your entire body. Like, it literally affects your entire body. I had foot surgery because I walked on the outside of my feet, which is something that is common for autistic people. Autistic people will be toe walkers, or they'll often walk on the side of the feet. Again, not all autistic people, but many of us. So I did that for so many years. I did damage to my foot, and I had to have foot surgery. So autism's in your brain, but it affects your freaking entire body. So as you get older and your body's breaking down and that kind of thing, there's more chance that you're going to need more medical help and attention. And it has been very helpful for me to be able to tell doctors, I'm autistic. These are the combinations I need. And I have been able to have a better medical experience by being able to tell doctors that I'm autistic. All but one. I've had one doctor a couple months ago who basically dismissed my concerns because of my autism. Again, there's bad actors out there, and I've got an appointment with a different doctor in that field next month. It's unfortunate because that delayed my care by like 5 months trying to get in to see another person, but it happens. But overall, in the last 2+ years since I've had my diagnosis, the times that I've interacted with dentist, eye care, my foot surgery, and my primary and physical therapist, them knowing I'm autistic has made a big difference in my care. And a lot of these doctors are not going to listen and respect a self-diagnosis. So if you're somebody who feels like you have a lot of medical care going forward, then having an official diagnosis could make a big difference. And same thing if you think that you might need more mental care. Most autistic people should be in therapy because pretty much all of us have CPTSD, trauma from being undiagnosed. So if you have access to therapy, being able to see a therapist is beneficial, but having that therapist know that you're autistic is going to make a huge difference. So again, there's reasons why you should and there shouldn't. If you are somebody who just wants to understand themselves through the autistic lens and make their life make sense through that lens, you don't really see a need for being able to disclose it to doctors, and you don't want to spend the money on a diagnosis, or you are planning on moving out of the country. These are all very valid reasons to not get an official diagnosis as an adult. Because again, it's not like you're going to be getting any kind of supports, at least in America. Again, I can't speak for other countries. So there's definitely some things that I could really use. I really, really would benefit if I was eligible for something that would be called a patient advocate. If I had somebody who could really help me navigate the medical field, for myself and my kids, that would be huge. That would be an accommodation from the government that I would greatly, greatly need. I'm not on disability because I'm married and my spouse makes enough money to care for me. I could work part-time. I could work certain types of jobs. I cannot work a lot of typical jobs because of my autism and ADHD. So before I got my diagnosis, I just thought something was wrong with me. But now it's like, oh no, I was actually disabled and just didn't know it. Now I get it. It makes more sense. Anyway, I hope this video was helpful. And if you've been on the fence about getting a diagnosis, I hope it kind of gave you some things to think about. And if you have any more questions, please feel free to ask them. And I will see y'all in the next video. Bye, guys.